my name is Emily Kuykendall, and I'm going to be comparing the healthcare systems of Hong Kong and the United States. Both Hong Kong and the United States are a mix of healthcare systems. The government of Hong Kong provides its residents with an easily accessible, low-cost coverage, though some people do choose a private insurance in which they pay for their own plan. In the United States, a majority, 89.6% of the residents, are covered by some sort of health care. Similar to us in Hong Kong, residents of the United States can't pick a private insurance in which they pay for their own plan. And some people are covered by the government, though in America they have to qualify for government coverage, either through their age, a disability, or their income level. In both countries, some people are covered by their employers and some people aren't covered at all, which I'll discuss in a later slide. An interesting fact about the Hong Kong government is that people become eligible for government coverage as soon as they have a valid visa and Hong Kong ID, whereas immigrants in the United States often have to wait up to 5 years before they're covered by CHIP or Medicaid. The infant mortality rate provides insight about a nation's population health. According to the CDC, infant mortality is the death of an infant before his or her first birthday. In 2017, the infant mortality rate per 1,000 live births in Hong Kong was 1.8 deaths, and in the United States was 5.8 deaths. These graphs of the infant mortality rate both show a gradual decline, which is a positive for the population health of both nations. Total healthcare spending per capita. In 2016-2017, Hong Kong's total healthcare spending per person was 21,433 Hong Kong dollars, which translates to $2,730.56 in US dollars. In the United States in 2017, the total healthcare spending per person was $10,224. So the United States government is spending a lot more per person on healthcare, but the government does not provide its residents with a low-cost healthcare as the Hong Kong government does. Emergency department visits per 100,000 people. In Hong Kong, in 2017, there were approximately 29,716 visits per 100,000 people. And in 2016, in the United States, per 100,000 people, there were approximately 44,000 visits. I picked these two pictures because I thought they really mirrored each other. On the left is a picture of an emergency room at Queen Elizabeth Hospital in Hong Kong, and the right is an emergency room at Maimonides Medical Center in Brooklyn, New York. They're both very crowded, but still show a sense of organization. Tobacco control efforts. The Smoking Public Health Ordinance of Hong Kong in 2006, 2010, 2016 was expanded to include more places, such as bus interchanges and a lot of outdoor places. The tax on tobacco products in 2014 in Hong Kong was raised 11.7% to $4.85 US. The Tobacco Control Office of Hong Kong conducts inspections and follow-ups after receiving smoking complaints, and they issue fixed penalty notices. In 2017, they issued 9,711 fixed penalty notices. The Department of Health has smoking cessation programs, things such as seminars and quit lines to promote people to quit smoking. 10% of the Hong Kong population in 2017, 15 and older, smoke cigarettes. In the United States, the CDC sponsors the Tips from Former Smokers media campaign and the 1-800-QUIT-NOW quit line, which both promote people to quit smoking. In 2012 to 2015, it was estimated that 500,000 people quit smoking for good because of this media campaign. All smokeless tobacco products have to include a warning statement on the packaging. According to the FDA, one of these statements is warning this product can cause mouth cancer, and that warning has to take up at least 30% of the two largest sides of the packaging. In 2009, the cigarette tax went up to $1.01 per pack. The Tobacco Control Act of 2009 allowed the FDA to have regulation over everything regarding the tobacco products. In 2017, 14% of Americans 18 and older smoke cigarettes. So these are two types of packaging. The left is in Hong Kong and the right is in the United States. The Hong Kong packaging has to include a graphic health warning on at least 85% of the packaging on the largest two sides. One of these is a skeleton smoking a cigarette, and this is the United States, and the packaging has a lot of appealing colors and nothing that would really turn away a potential buyer or cause them to think twice before buying as it would in Hong Kong. Safe drinking water. 70 to 80% of Hong Kong's water comes from Dongjiang in China. 21 treatment plants across Hong Kong ensure safe water for its residents. In the past 20 years, there's been a 17% increase in water consumption. In 2015, Hong Kong had a water scare in which the lead levels tested in water were alarmingly high. The World Health Organization advises chloroform levels be no more than 300 micrograms of chloroform per liter of water, and Hong Kong is well below this requirement at 50 micrograms per liter. In the United States, the Safe Drinking Water Act, which was enacted in 1974, caused there to be many standards in the water before it can be consumed by the residents of the United States. Many areas, such as in Flint, Michigan, are in violation of this act. These are 4 samples of water from Flint, Michigan, from one home. The discoloration is due to high levels of lead in their water. $150,000 water systems are across the United States nationwide. And the standard chloroform levels in the United States are at 80 micrograms per liter, which is a bit higher than Hong Kong, but still well below the World Health Organization's requirements. Uninsured rates of adults. In 2015, about 51.3% of people were uninsured in Hong Kong. In 2014, about 33% of people were covered by private insurance in Hong Kong, but the government provides that low-cost, easily accessible insurance to the people who cannot afford private insurance. In the United States in 2017, 8.8% of people were uninsured, 67.2% of people were privately insured, and 37.7% were qualified for some sort of government coverage. Unemployment rates. In 2017 in Hong Kong, about 3.09% of the population was unemployed. The United States was a bit higher in their unemployment rates, and in 2017 they were at 4.3% of the population was unemployed. Though these graphs fluctuate a bit, they both show a gradual decline in the unemployment rates of the countries, which is really positive to the social and economic environment of the countries. So to summarize, both countries have a mix of healthcare systems. Regarding the infant mortality rate in 2017, there were 1.8 deaths per 1,000 live births in Hong Kong and 5.8 deaths per 1,000 live births in the United States. In 2017, per person, Hong Kong spent $2,730.58 in US dollars on healthcare, and the United States spent $10,224 per person on healthcare. In 2017, per 100,000 people, there were about 29,716 emergency room visits in Hong Kong, and about 44,000 emergency room visits per 100,000 people in 2016 in the United States. 10% of the population in 2017 in Hong Kong, 15 and older, smoked cigarettes. And in 2017 in the United States, 14% of the population 18 and older smoked cigarettes. The water chloroform levels in Hong Kong average to be at 50 micrograms of chloroform per liter of water. In the United States, it's about 80 micrograms of chloroform per liter of water, which are both well below the World Health Organization's requirement. In 2017, about 3.09% of the Hong Kong population was unemployed, and 4.3% of the population of America was unemployed. In 2015, 51.3% of Hong Kongians were uninsured, but the government provides the low-cost, easily accessible plan. And in America, in 2017, 8.8% of the population was uninsured. And unfortunately, Americans must qualify for government coverage in the United States. So it seems that the Hong Kong government is making healthcare a lot more accessible for its residents than the United States. There are a lot of gaps in this data between the two countries, which shows that there's a lot of room for improvement in both countries. So here are my references. Thank you.
What was that?